Thank you for viewing this educational presentation. This module discusses Holmium laser enucleation of the prostate, or HoLEP. A man's prostate grows bigger as he ages. This common non-cancerous enlargement of the prostate is called benign prostatic hyperplasia, or BPH for short. The growing prostate can cause trouble when it tightens around the urethra, obstructing urine flow, impairing bladder emptying, and causing frequent, urgent urination. BPH can be successfully treated when it does occur. Treatment options include lifestyle changes and regular monitoring of symptoms, supplements and phytotherapy, medications that relax the muscle within the prostate called alpha blockers, medications that shrink the prostate called 5-alpha reductase inhibitors, medications to relax the bladder called antimuscarinics, combination therapy using different types of medications together, or surgical therapy. In general, treatment progresses from simple measures to more aggressive measures as the severity of the problem increases. There are many types of surgical options available, although not all centers and not all doctors will offer each one of these. This slide shows that the choice of surgical treatment progresses from minimally invasive to more aggressive as the prostate enlarges. Surgical options include microwave therapy, or TUMT, needle ablation, called TUNA, prostatic stents, laser vaporization, or PVP, transurethral incision, or TUIP, transurethral resection, called TURP or TUPPER, laser prostatectomy, or HoLEP, and open surgical prostatectomy. Surgery is recommended for BPH patients who are unable to urinate, who have kidney damage, frequent urinary tract infections, significant urinary bleeding, or bladder stones. Surgery is also recommended when medications fail to satisfactorily relieve urinary symptoms. This, in fact, is the most common reason that surgery is recommended. Transurethral resection of the prostate, or TURP, also called TURP or TUPPER, is the conventional surgical treatment for BPH. This operation involves removing prostate tissue that is squeezing around the urethra or urine channel and obstructing urine flow. Removing this obstructing tissue opens up the urine channel, allowing urine to flow more freely. This in turn allows the bladder to work less hard to empty, which relieves bladder symptoms such as frequent and urgent urination. Though effective and safe, TURP can be associated with long hospital stays in some patients and slow recovery times. It carries a risk of discomfort and bleeding, retrograde ejaculation or the backwards flow of sperm into the bladder during climax, and very rarely, troubles with urinary control or incontinence, and erectile difficulty. Because of the disadvantages associated with TURP, alternative procedures for treating BPH have been introduced. One such procedure is called Holmium laser enucleation of the prostate, or HoLEP for short. Similarly to TURP, HoLEP is a surgery that removes obstructing prostate tissue. Unlike TURP, however, HoLEP uses a laser, a device that produces a beam of high-energy light, a morcellator, and a vacuum to cut out and remove the obstructing prostate tissue. Compared with TURP, HoLEP seems to be as effective at managing the symptoms of BPH, may be associated with fewer complications, may require a shorter hospital stay and catheterization period, and may have a faster recovery. It may be safer for patients on blood thinners than other surgeries, and can also be performed on extremely large prostate glands, which might normally require open surgery through the abdomen. There are a few things you can do to prepare for the HoLEP procedure. First, follow your doctor's instructions on eating, drinking, and taking or avoiding certain medications before the procedure. On the day of surgery, bring a list of all the medications you are taking and any questions you might have. Wear comfortable, loose-fitting clothing, and arrange to have a ride home, since you will not be allowed to drive for 48 hours after surgery. Your doctor may provide you with additional or different instructions. Consult your doctor if you have any questions or concerns. HoLEP is performed in the hospital. The specifics of your situation may differ, and your doctor will review the procedure with you beforehand. Typically, after arriving at the hospital, you may have some paperwork to sign, and you will then be asked to undress and change into a gown. A nurse will check your vital signs, and an intravenous or IV line may be started. Once in the operating room, you will receive various fluids and medications through your IV. You will then be given an anesthetic, which is medication that blocks the sensation of pain. If you are given a general anesthetic, you will be asleep for the surgery, and if you are given a spinal anesthetic, you will remain awake, but the lower half of your body will be numbed or frozen. Next, you will be positioned with your legs up in stirrups. The surgeon will then insert a small instrument called a cystoscope or resectoscope up through the urethra and towards the prostate. A visual lens and laser are then passed through the hollow center of the resectoscope. Next, the laser is used to cut out the obstructing prostate tissue, as shown here. This obstructing tissue is removed as one or more large pieces, like shelling out an orange from its peel. This process is called enucleation. Importantly, this differs from resection, which is done in the older standard procedure called transurethral resection of the prostate, also called TURP or Tupper. In the TURP procedure, the prostate tissue is whittled away in small pieces, which can then be flushed out through the scope. After a laser enucleation, once the tissue has been cut away, the large piece or pieces have to be removed from the bladder. To do this, the surgeon grinds up the tissue with a device called a morcellator and removes it through the urethra. Because the laser seals the tissue as it removes it, there is little or no bleeding. If there is any bleeding, the surgeon will insert a long, flexible tube called a catheter up through the urine channel and into the bladder. The catheter helps the bladder drain urine and is left in the body for a certain period of time, depending on the individual situation. After surgery, depending on your particular situation, you will either be discharged from the hospital a few hours later, or you might need to stay overnight in the hospital. In either case, if you had a catheter inserted, you will likely not have to wear it for more than 24 hours. You may resume normal activities in the few days following surgery, but you will have to avoid strenuous activity, sexual activity, and heavy lifting for about 2 weeks. It is recommended that you drink plenty of water and avoid drinking coffee, tea, soda pop, and alcohol for the first few days following surgery. As with any surgery, there are potential risks associated with the HoLEP procedure. In the operating room, there can be damage to the bladder caused by the laser or the morcellator. After surgery, it is common for there to be a little bit of blood in the urine, and this is usually relieved by drinking more water. You may also experience some mild burning when urinating, but this should subside in about 1 to 2 weeks. Frequent urination or an urgency to urinate for the first month following surgery is also normal, and your doctor may suggest some medications to relieve these symptoms. There may also be need for a catheter, the tube passed into the bladder to help urine drain, but this shouldn't last longer than a few days. If this is the case, your doctor or nurse may teach you how to care for and remove the catheter yourself. Later on after surgery, significant problems are uncommon. The risk of incontinence or urine leakage is low. As stated previously, you may need to wear a catheter for a few days following surgery. HoLEP surgery should not affect your ability to have an erection or an orgasm, though backwards or retrograde ejaculation may occur. In this, the ejaculate goes backwards into the bladder instead of forwards out of the urethra. Retrograde ejaculation is harmless, but it can decrease the chance of fathering children without assistance. Finally, it is possible to develop scar tissue at the site of surgery, or have some prostate tissue regrow, even years later, which may obstruct your urine flow again and require another procedure later on. Contact your doctor immediately if you have significant bright red blood in the urine or large blood clots which do not clear on drinking more fluids. A small amount of blood at the beginning or the end of the stream is normal. Also, contact your doctor if you develop a fever of over 101 degrees Fahrenheit or 38 degrees Celsius, an inability to urinate for more than 4 hours despite a feeling of fullness, a feeling of bladder fullness that does not go away after urinating, or severe pain at any time. Following the HoLEP procedure, patients experience immediate relief and immediate improvement in urine flow. A full recovery, though, including an improvement in urgency and getting up at night, can take up to 3 months. To summarize, Holmium laser enucleation of the prostate, or HoLEP for short, offers BPH patients a safe, effective, well-established alternative to traditional surgery. HoLEP uses a laser to cut and remove obstructive prostate tissue, allowing urine to flow better. It quickly relieves urinary symptoms, is usually blood-free and painless, does not often require catheterization, has a very short recovery period, and produces long-lasting results for most patients. This slide lists some of the many resources available where you can find more information about holmium laser enucleation of the prostate. These current references were used to assist in the preparation of this module. All of these are available through your local medical library or the internet if you are interested in more detailed reading on this subject. Thank you again for viewing this presentation. Talk to your doctor if you would like to learn more about your condition.